Since you're listening to the Scoliosis Experience podcast, you've probably looked into scoliosis treatment in the past. And one thing that I wanted to go over today is what things should you avoid when looking at a specific scoliosis treatment option? What are the things that you should avoid so that you get the best treatment possible and you do those things that have been found to be effective? So that's what our topic is today on the Scoliosis Experience podcast. 5 things to avoid when looking for scoliosis treatment. Okay, so these 5 things, they come from experience and observation with my patients and others who have been looking for scoliosis treatment. Consistently, I see patients who find me online or they're referred to me by their physicians, things like that, and I ask them what they've done in the past. And sometimes they've done nothing. Sometimes they've tried multiple things. And this also comes from that I'm a member of the International Conservative Scoliosis Treatment Community, SOSORT, and we look at research annually. Annually, we have a meeting where we look at the research and what it's showing, what it's supporting, and what treatments are effective in conservative treatment. So I want to share these 5 things to hopefully help you avoid going down a road that isn't effective or going down a road that isn't necessary. So, okay, well, let's get into it. My first thing to avoid with scoliosis treatment is if you go to someone and they want to do bracing when it's not indicated. What I mean by that is if someone wants to put a brace on you when it hasn't been shown to be effective or necessary. So let's get into that a little bit. Let's dissect when bracing is appropriate and indicated and when it is not. So most of the time with adolescent scoliosis, so teenagers, preteens, bracing is indicated when a curve gets to 20 or 25 degrees. A lot of times what we're seeing around here in Utah and in the nation as a whole, at 20 degrees we start thinking about a nighttime brace, especially if the child is young. At 25 we start thinking about daytime bracing or nighttime bracing depending on how much growth they have left. If a curve is less than 20 degrees and someone is wanting to brace, that may not be the most effective. There are some instances where, let's say we have a young juvenile scoliosis patient who has a high risk of progression, maybe has a family history that, a lot of their family has gone to surgical range. Maybe they're young enough that they have a lot of growth left. Those are all times when bracing could be indicated. But if it's a 10-degree curve and someone wants to put you in a brace, most likely that's too aggressive and not needed. So there are 2 other times when I see bracing talked about when it's not really necessary. And one is when a teenager is done growing. When they're done growing, the research shows that spine is skeletally mature and bracing is not indicated because bracing is helping to modulate growth and change the shape of the bones. And so when they're done growing, as long as their curve is, even if their curve is over 45 degrees, it's not necessarily indicated to continue bracing them. I've been seeing lately some specific providers who are keeping kids in a brace long term. So they're done growing, they might be 16, they're in high school, they haven't grown in a couple of years, they're well past puberty, and they're still being put in a brace and kept in a brace because of the possible potential of reducing the curve more. The problem is bracing is meant to utilize growth modulation, meaning that as the child grows, that we have remodeling of the vertebrae and they change shape. If the child is not growing, that is not happening. I have concerns when that's the case. Also, the mental effect of keeping someone in a brace past when they're skeletally mature, I don't think is necessary. The second time that I'm talking about is in adulthood. We don't have great data on bracing in adults. And I can see the utility of bracing an adult who just can't control their curve, who has a lot of weakness, a lot of pain, and just needs some support. The problem is the rigid custom braces that we have, I don't think are the greatest for that, and we don't have a great option for bracing. So sometimes I've used just over-the-counter back braces for that. Sometimes I have sent for a custom-made TLSO or a brace that's similar to our teenagers. But that's not very often. I want to see if they can manage their curve on their own, if they can support their spine without external support. I would much rather have the body support the spine and correct against the curve than have something external. So that's one of my number one pet peeves lately is bracing that is done when it's not necessary. And this is according to me. I mean, other people may have different thoughts about this, but I think we have to go on a case-by-case basis, that each person, this should be evaluated. But for the most part, my adult patients, I want their body to be the brace. In adolescents, if they're done growing, I want them out of the brace and learning postural scoliosis correction exercises so that they can do that. So that's number one thing to avoid, bracing when it's not needed or necessary or supported by the research. Number two, the second thing to avoid when looking for scoliosis treatment is when things seem too good to be true. The saying goes that if it seems too good to be true, it probably is. And in scoliosis treatment, especially if someone says that they can fix your curve, if they can cure it, if they can take it away, I would be very skeptical of that. I would avoid that because the research is not supporting that. We have vertebrae that are shaped differently. So unless they're going to go in and reshape the vertebrae, they can't fix the scoliosis curve. And there's no technique, to my knowledge, where they go in and reshape the vertebrae. So if something seems too good to be true, if they're marketing that they can fix your scoliosis, that you won't have it anymore, that your spine will be straight, I would be very skeptical of that, and I would avoid seeing someone who claims that because the research just doesn't support that. And I think maybe one day we'll get to the point where we can fix the scoliosis curve, but that's not now. So I would be very cautious on the claims that people are making on fixing the scoliosis curve. Along with that, talking about reductions from like 40 degrees to 5 degrees and things like that. Sure, that might happen occasionally, but promising that for each of the patients is a sign that they may not be supported by research. So that's number two. When it seems too good to be true, that is probably something to avoid. Number three thing to avoid with when looking for scoliosis treatment. Number three is if there's limited research. So if you are looking into a treatment technique, a treatment modality, or a place to go for scoliosis treatment, and you ask them what research they have to support what they do in scoliosis treatment, and they don't have any, and if they don't, then they can't point to any research or studies that have been done to help support what they're doing, I would be cautious on that. Sure, everything's got to start somewhere, right? So maybe there are some techniques that haven't been researched yet that are effective, and that's definitely possible. But there are a lot of treatments out there that are being done that don't have any research basis and haven't been validated in the research and shown to be effective. So I would be careful about doing that. Not that you can't do it, be cautious on that. So at my clinic, one of the main reasons that I started with the Schroth method for scoliosis is it has the most research to back it of any of the scoliosis specific exercise techniques that are out there. So when you do a literature review or you look at studies talking about scoliosis conservative treatment, the Schroth method is by far the most researched and research-backed technique out there. And so when I opened my practice and I wanted to specialize in scoliosis, that's the one that I got trained in first. And in that way, if someone wants me to produce studies to support what I do, I could easily present them with 20 studies or more that support what we do in the clinic. And when I got trained in the SEAS approach, the scientific exercise approach to scoliosis from Italy, same thing. There is research to back the SEAS approach. And I think that is very important, that if someone is claiming that they can really help the scoliosis curve, they should be able to back that up with peer-reviewed journals that are showing that it is effective. If we look at case studies, I see on some people's websites they'll put case studies where they'll talk about someone who had a good result. And I think those case studies are still a good thing, and we need those case studies, and we put those on our website as well. But case studies are not as strong as research studies because it's only a sample size of one person. So that person may have had a good result, but they may have had a lot of other variables that play into that. And so I think that's something to be aware of. If all you're seeing is case studies, this is something that hasn't been really validated in a specific research study. And so that's something that I would be cautious about as well. If they have nothing, if they have no case studies and no research to back what they do, definitely that's a red flag for me. If they have case studies and they can show that what they're doing is effective, that's better than nothing. But the best is to have research to support it, keeping in mind that everything does have to start somewhere. But they should be able to back what they're doing. So that's number three. The third thing to avoid is if there's limited research and they can't back up what they do in the literature and the studies. So the fourth thing to avoid when looking for scoliosis treatment is when someone is just treating you stretching the concave side and strengthening the convex side. This is something that my own profession, I'm a physical therapist, and in my own profession, this has been taught for decades. This is what I learned in school. It's what they still learn in school, and what I still see, unfortunately, on YouTube for treatments treating scoliosis. So the idea, I'll just describe the idea a bit. So scoliosis is a curve side to side of the spine. So we have a concave side and we have a convex side. The muscles on the concave side, we're taught that those muscles are shortened. And so we need to stretch those to open up that concave side. And then the muscles on the convex side are lengthened over the curve. So if we strengthen those muscles, then it will pull that curve straighter. And like I said, this is how I learned scoliosis treatment as a PT student. It's how a lot of my PT students still learn about scoliosis treatment. Unfortunately, it's a lot in medicine. It's the same thought, and I see it everywhere online. The problem is that scoliosis is a three-dimensional problem, first of all. So with that approach, we're not addressing any of the other two planes. We're not addressing the hypokyphosis that comes with it. We're not addressing the rotation that comes with it. We are only addressing that one plane, which is not the way to treat it because, well, it's a three-dimensional problem. And so the other thing is that strengthening the convex side, especially with someone that has pain with their scoliosis, most of the time I see pain on the convex side of the curve because those muscles are being overworked. And we need to offload those muscles by getting the concave side muscles as well as the other muscles around the spine to support the spine. We can't expect just the convex side muscles to support the spine. Then we create an imbalance that is worse than what we started with. The other thing is both sides, and the research lately is showing that both sides of the spine, the paraspinal muscles, are weak. And so because of that weakness in the paraspinal muscles, we need to strengthen both sides of the curve. We don't just need to strengthen one side of the curve. So if we need to strengthen both sides of the curve because they're both weak, then strengthening one side does not affect the scoliosis. This comes into play when there was a research study that looked at scoliosis treatment using side planks and doing side planks on just the convex side of the curve, and they were showing a significant decrease in the curve with doing that. The problem is that usually we have two curves in the spine. And so what do we do if we have two curves in the spine? Which side do we do side planks on? And the study design for that study was not good, and that is not the way we treat scoliosis, or it's not the way we should treat scoliosis. So if you're going into someone who is saying that we need to stretch out the concave side and strengthen the convex side, that is a very old school way of treating this scoliosis curve. Too simplistic, and it's not specific to the curve. It's not specific to the 3 dimensions that we have in scoliosis. So I would be wary of that, and I would be cautious of that. That basically means that you're working with someone who doesn't truly understand scoliosis. So that's number 4, if someone says to stretch the concave side and strengthen the convex side. Number 5, the fifth thing to avoid with scoliosis treatment is when treatment is not directed at the curve specifically. If you're going in and you're working with someone who is just doing core strengthening and stretching your hamstrings and working on postural control, and they're not doing anything specific to the asymmetrical problem that you have, it kind of goes along with number 4. This is something that I would not recommend and I would be cautious of, because general core strengthening and general physical therapy has not been shown to be effective in changing the trajectory of the scoliosis curve really at all. It can be helpful in conjunction with scoliosis-specific exercise, but treatment needs to be specific to the curve. It needs to be specific to the person, ideally, but it definitely needs to be specific to the scoliosis curve. And so when you're researching scoliosis treatment methods, look for someone who can provide that. Look for someone who can provide specific instruction to your curve. If they can't do that and they can't describe how they would change this treatment with someone else who had a different curve, then it's probably not effective. And it needs to be specific to the curve in order to be effective. So the best treatment involves being specific to the curve. Just remember that. And if you ever are wondering about that and you ask them and they can't back it up, that's something to be wary of as well. So just a quick recap, the 5 things to avoid when you're looking for scoliosis treatment. Number 1, if they want to brace you when it's not indicated, especially for adults and especially for teens who are done growing. Number 2, when what they claim seems too good to be true. If it seems like if they're saying that they can fix the curve, I would be cautious on that. Number 3, if they have a limited research and can't back up what they do with research that's been published and peer-reviewed, that's a concern. Number 4, if they say to stretch the concave side and strengthen the convex side, that is not scoliosis-specific treatment. And number 5, if they aren't specifically treating your curve, specific to what type of curve you have, that is something else to avoid. One extra bonus one, maybe number 6, is if they are against surgery at all costs. Now, I understand that a lot of people listening to this want to avoid surgery, and I also want to avoid surgery if we can. But I am not anti-surgery. I don't want my patients to progress to needing surgery, but I also am in favor of surgery when it's indicated. So surgery has come a long way. There are great surgical techniques. There are even some good surgical techniques like VBT that can be utilized while they're still growing. So I'm not anti-surgery, And if someone is, and they're willing to let you get to a 75-degree curve just to avoid surgery, or a 95, I've had a few patients with 95 to 110-degree curves, the surgical options are better than they used to be. And I think that a surgical consult is indicated in big curves. And I usually have my patients go get a surgical consult. But that doesn't mean that they have to have surgery. It just means that the surgeon should be part of the multidisciplinary approach when we're looking at scoliosis treatment. If they're not, and they actually need it, then we're going to wait longer than we should. I don't want to push someone to go too early to surgery, but I also don't want to delay it too late. For example, if someone is in their, let's say their 50s and has a 65-degree scoliosis curve, they probably have some time to work on that curve and see what they can do conservatively, as long as we don't have neurological compromise. If we have drop foot and we have compression on the nerves or lung compression, things like that, then it may be something that I will push them to do earlier than that. But conservative treatment can definitely be done with a curve like that. But if someone is, let's say, 70 and is delaying surgery because they just don't want to do it, and their curve continues to progress, and then they get to where they're 80 and they finally decide that they want to do surgery, many surgeons won't do that kind of surgery on people who are 80. So then we just delayed surgery where it can't ever happen, rather than doing surgery when it could have happened and may have benefited their quality of life. So that's, in my opinion, that's what it always goes back to. Can we improve the quality of life of our patients by doing this? Surgery, there's risks. There are some bad outcomes. There are some great outcomes. But with surgery, you can't go back from that decision. Once you've had surgery, you've had surgery. With scoliosis-specific exercise, we're strengthening, we're improving stability, we're improving postural awareness. As long as we're not sacrificing neurological compromise, we do have time to wait and work on quality of life, work on strength, work on balance without going to surgery. But again, I am not anti-surgery in any way. I just feel like we should do as much as possible before going to that. So kind of not really a tangent. That'll be our number 6 thing to avoid with scoliosis treatment. If someone is telling you that they will avoid surgery at all costs, especially if they're a provider and saying that they know scoliosis, they do not know scoliosis if they're encouraging you not to see a surgeon no matter what. A lot of times they'll say, well, if you go to see a surgeon, all they want to do is cut. Well, they are a surgeon, but maybe you should be looking at what type of surgeon you're going for. The best surgeons that I know in the area in Utah, they almost try and talk you out of surgery to make sure that you're committed to surgery. So I think surgery can be something that is addressed in a good way, and it shouldn't be an option that is just put off to the side and never thought about, because it is part of the multidisciplinary approach, and we need that in some cases. I hope this podcast episode helped you to realize, if you're looking for scoliosis treatment specifically, to realize some things that you should be looking for in scoliosis treatment, as well as some things that you should be avoiding when finding scoliosis providers. I would love to say that all providers who say they treat scoliosis are specialized in it and do equally good, but I cannot say that that's the case, and it is good to do your own research. If you want to contact me at Align Therapy in Lehi, Utah, or in St. George, we have a clinic in St. George, Utah as well. We can back up what we do with research. We have case studies. We can talk about specifics of how we treat scoliosis in a 3-dimensional way. We are not doing old school scoliosis treatment with stretching the concavity and strengthening the convexity, and we use bracing appropriately. So obviously I'm probably a little biased because I am a physical therapist, but I've been treating scoliosis patients for 12 years now, and I've seen some things that definitely should be avoided. And so hopefully I can help you to avoid those things that aren't effective and that might be expensive and that might be a waste of time, when time is of the essence with scoliosis treatment. So I appreciate you listening to this podcast and listening to me ramble about scoliosis. I could talk about this for hours, but I will leave you with that. And if you have any other questions, post those questions in the comments or give my office a call, and we will do our best to answer those things. We do free consultations and would love to see you in the clinic. The number to my clinic, just so you know, is 801-980-0860. And thanks for listening, and we'll see you next time.